If you're watching this video, it is likely that you've decided to have a planned cesarean, also known as an elective cesarean section. There are many reasons why you may have chose this. For example, if you've had a previous cesarean section, or your obstetric doctor might have told you that it's safer to deliver your baby by cesarean rather than vaginally. And also, it might be that you want to have a cesarean section, which is a valid reason in itself. Reasons why you may have been advised to have a cesarean section include if you have a low-lying placenta, also known as placenta previa, if your baby is breech and it's been unsuccessful to turn the baby around, and also if you have infections such as the first onset of genital herpes late in your pregnancy, or if you have untreated HIV, and also maybe because you've been offered an induction of labour and this isn't the route that you want to go, so you've decided to have a cesarean section instead. But there are many reasons why you may be offered a cesarean section, and your doctor will go through this with you. If you have decided to have a cesarean section because of personal circumstances not related to the pregnancy, or because you've had a previous traumatic birth and you have anxiety around the birth this time, it's important that you discuss this with a healthcare professional, as it may be beneficial for you to have support from a specialist who has experience giving advice to women with anxieties around birth. Every birth is very different, so because you've had a previous traumatic birth, it doesn't necessarily mean that this birth will be the same. So it is important to discuss your anxieties and fears with somebody who can help you with this. But if you do decide to go ahead with a cesarean section after having this support, then the obstetric doctor will discuss all the risks and benefits with you. So now I'm going to go on to tell you how you can prepare yourself for a cesarean and what to expect. But I just want you to know that every hospital does their elective cesareans differently. So your local hospital will go through their process with you, but this is just a video to give you an idea of what to expect. So you will usually have a pre-operation assessment, and during this assessment they'll take your blood, answer any questions you may have, and they'll also provide you with an antacid to take before your operation, and they'll advise you what time to take this. And following this you'll need to be nil by mouth, which means no eating or drinking. You will then attend the hospital on the day that you've been booked for your elective cesarean, and on this day try to avoid to wear any jewellery, makeup or nail polish, and make sure to bring all your things in your bag that you need, and I am going to make a video soon on what you should take in your hospital bag. You will then be provided with a hospital gown and some compression stockings, as these compression stockings will reduce your risks of blood clots, especially as you won't be mobile following the operation for a few hours. And then you will be seen by your midwife, the anaesthetist and the obstetric doctors who will be caring for you that day, as they'll go through a few questions with you and answer any questions you may have. It is also important to make sure that a consent form has been done with your doctor before having the operation. Usually you would have had this done in a clinic with your doctor, but if this hasn't been done, then it may be done on the day of your operation. So for the operation itself, your birth partner will be able to attend with you, and they'll be provided with a gown and hat. And then when you're in theatre, it is possible to ask the theatre staff to play some music that you'd like, so this can make the delivery personal to you. When you have a cesarean section, usually a spinal anaesthetic is used, which involves an injection in your lower back to numb you from the waist down. And this is generally safer than a general anaesthetic. And the benefit from this is that you'll be awake to be able to see your baby after they've been born. You will then have a catheter inserted by your midwife before the procedure itself starts taking place. The operation itself usually takes up to an hour. Your baby will be delivered by the obstetric doctors with a cut on your lower abdomen at bikini line level. And then following the delivery of your baby, the midwife will do all the baby's checks and the weight, etc. And then providing that you and baby are both well, you'll be able to have skin to skin with your baby in theatre with support from your midwife. This is such an exciting time and definitely a moment that you'll never forget. So do make sure to also take your phone into theatre, as you'll be able to take pictures of baby and someone will be able to take photos of you and your birthing partner with the baby when baby's skin to skin. After the operation is finished, your baby and your partner will be taken into the recovery room where you will shortly follow them. The recovery room is just somewhere that you go after the procedure for close supervision before you are able to be transferred to the ward. You will be cared for by a recovery nurse in recovery, where she will do your observations and do a few other checks. And as long as you're okay, you'll be able to have something small to eat. And usually the go-to is tea and toast, as the hospital's tea and toast is very good. The midwife will also need to do a few checks, and she will also be able to support you with feeding your baby, whether this is breast or bottle feeding, depending what you want to do. And then following this, you'll be transferred to the postnatal ward. On the postnatal ward, you'll be encouraged to mobilise 6 to 8 hours following the operation, and it is likely that you'll feel uncomfortable and not very steady on your feet, but the staff on the ward will be there to support you, and after you've mobilised, you'll be able to have your catheter out. For a successful recovery, it is really important to mobilise, as this will help you to get back to your usual self more quickly. After having your caesarean section, I would encourage you to take your pain relief regularly, which include paracetamol, dihydrocodeine, ibuprofen, and your hospital may provide you with these to go home. Constipation can also be an issue postnatally, so if you are struggling with this, you can have peppermint tea and stool softeners that can help with this. You can ask your doctor to prescribe them for you. You may also be given blood thinning injections to take home with you to have postnatally, but this will depend on certain risk factors and whether you score to have these, and these will reduce your risks of having blood clots. And as long as yourself and baby are okay, it is likely that you will be going home the following day after your caesarean section. When you arrive home after your caesarean section, it's really important that you don't overdo it and that you have plenty of support around you. You mustn't do any intense activity such as driving until 6 weeks after your caesarean section. And I always say to women that you shouldn't drive until you feel confident that you can do an emergency brake. When you're at home, I'd also encourage you to check your wound. If you're worried about it in any way, if it's red or swollen, hot to touch, any leaking or gaping, if there's an offensive smell, if you feel unwell in yourself or feeling feverish, it's very important that you go to your local maternity assessment unit, as it may be that you have an infection. I would also recommend for you to keep the wound clean. Don't use any soap initially, only water in that area, and tap dry with a towel. And letting air get to the wound will also help with the healing process. But if you are concerned in any way, then do contact your local maternity assessment unit or your local doctor. But if you do have any questions, then do just let me know in the comments, and I really hope this video has helped, and good luck. I hope your delivery and everything goes well, and I shall see you in the next video.